Hello friends, my name is Ankit. I make educational videos on US healthcare. I also write blogs on US healthcare trends. I'll leave the link in the description below for your reference. If you are new to my channel, welcome. Please like and subscribe to my channel so that the notifications are enabled for the future content. In this video, we will talk about what is Blue Button 2.0. Blue Button 2.0 from CMS is an API that contains 4 years of Medicare Part A, Part B, and Part D data for 53 million Medicare beneficiaries. This data reveals a variety of information about a beneficiary's health, including type of Medicare coverage, drug prescription, primary care treatment, and cost. Beneficiaries also have full control over how their data can be used and by whom, with identity and authorizations controlled by mymedicare.gov. The Center for Medicare and Medicaid Services Blue Button API enables Medicare beneficiaries to connect their Medicare claims data to the application, services, and research program they trust. The CMS Blue Button API enables a developer to register a beneficiary-facing application, enables a beneficiary to grant an application access to 4 years of their Part A, Part B, and Part D claims data, uses the HL7 FHIR standard for beneficiary data and OAuth 2.0 standard for beneficiary authorization. The mission of the Blue Button 2.0 project is to enhance CMS current Blue Button service to provide a developer-friendly, standard-based data application programming interface that enables beneficiaries to connect their Medicare claims data to the applications, services, and research programs they trust. The Blue Button service was established in 2010 as a joint effort of CMS and the Veterans Administration. Since that time, Blue Button has been used by more than 1 million beneficiaries to download their CMS information via the mymedicare.gov portal. The third-party app developer sandbox access. The Blue Button allows third-party app developers access to the sandbox using below steps. Join the developer sandbox and register a sandbox application. Generate a sample token. Call the API to retrieve synthetic data for a sample patient. Review the response data. Access the synthetic dataset to try additional calls. In the next few slides, we'll be talking about the various steps that developers have to follow along with the visual representation. The step 1 is for the developer to join the sandbox and register a sandbox application. You will need to create an account to join the developer sandbox. Once you have verified your account, log in and click Add an application from the developer sandbox homepage. Register a new sandbox application to get a client ID and client secret. That is like keys to the kingdom. You can also use one of the Blue Button sample applications. You need to include at least one callback or redirect URL. You can change any of the information later in My Sandbox apps. The second step is to generate a sample token. To test out the Blue Button API, you must first generate a sample token that represents a beneficiary granting consent to access their CMS Medicare claims data. We have documented the steps how you can generate a sample token. The next step is to click the authorize as a beneficiary at the bottom of this screen to authorize. Now you will be directed to the login page for Medicare.gov. You can use the synthetic user credentials issued by CMS, which we have documented in later part of this presentation to connect to the CMS sandbox. Once you complete that step, you will be able to log in with one of the synthetic user accounts. Depending on your application, you can either share all of your data or share healthcare data, but not your personal info to test your application. Click Allow to authorize data sharing. Now there are options to switching from V2 to V1 or vice versa on authorization details page. You can follow through the steps as documented in this guide to implement the process. Now the next step is to make the call to the API. After you obtain your access token, you can call the API using Postman or curl. To call the API using Postman, we have documented the steps. You would have to provide the token name, grant type, callback URL, authorization URL, access token URL, client ID, client secret, and scopes, along with client authentication details. Once you click Request Token, you will see a pop-up for your Medicare account. Log in using one of the synthetic beneficiaries as documented below. You will be able to access the synthetic data. In order to access the full synthetic data set for an individual synthetic beneficiary, you can do the following. Set up your SANDBOX application. Log out of the SANDBOX. Access the authorization URL for V1 or for V2. You will be redirected to the Medicare authorization screen on Do Not Access the page directly. Use one of the 30,000 provided usernames and passwords. We have documented the synthetic beneficiary account details again for your reference, but as we mentioned, once you log in, you will be having access to 30,000 synthetic user accounts. Blue Button 2.0 has really revolutionized the healthcare FHIR interoperability landscape by making data available to Medicare enrollees. It is used as a base by the various organizations for patient access API implementation for the medical, clinical, provider directory, and formulary data sharing between Medicare Advantage, Medicaid, CHIP plans along with their members. If you'd like us to talk about any other topics, please share the comments. Until then, see you next time. Have a good day.